Welcome to this episode of Ask Dr. Christina. I'm really excited about this. I've been seeing a lot about this SIBO, small intestinal bacterial overgrowth, and today I'm hoping to share with you some information about it, what you can do about it to find out if maybe that's what you've been struggling with your digestive distress or your brain fog. But I hear this often in my practice. Even when I eat healthy, I feel worse. So this topic today, SIBO Decoded, Why Sometimes Healthy Diets Makes You Feel Worse, is something for those of you people who are trying everything and really can't seem to figure out what to do. And you've gone through your traditional testing, or you've been told by a gastroenterologist, just do this kind of diet forever so you don't have symptoms. Also, not a great strategy. So, without further ado, let's get into it. A little bit about me for those of you who are new here. I've been practicing for just over 26 years in the community practice as a chiropractor, just about 10 years as a functional medicine practitioner, and I love learning. So I've done lots of advanced training in functional medicine and gut health. It's one of my passions in autoimmunity, functional pediatrics, and Dr. Wall's protocol, and Bredesen Recode 2.0 for cognitive decline. And I think for me, one of the most powerful and exciting pieces of functional medicine is seeing how powerful diet and lifestyle changes can be to help really resolve and manage the symptoms of chronic illnesses and autoimmunity and chronic gut issues. And I am always amazed at how little we know about these topics. So when I started really educating my population and educating my patients who had been struggling for decades on this information, I started seeing incredible results because supplements aren't the strategy. It has to be a whole lifestyle and diet and understanding what actually is going on. So, what we're going to cover today in SIBO. So, we're going to talk about what is SIBO, small intestinal bacterial overgrowth. Sometimes it's just called bacterial overgrowth. What are the symptoms? What are symptoms that you may be having that no one seems to be able to fix? Maybe your labs look good, maybe your diet is pretty good, um, but you're still having symptoms. And so, some of those symptoms, the more common ones and the more rare ones, we're going to go over some of the causes of small intestinal bacterial overgrowth. Um, how can you identify if you have small intestinal overgrowth? And there's some controversy about some of these tests, and we'll go through them. And then the functional medicine approach to helping heal and fully resolve small intestinal bacterial overgrowth. So, what is SIBO? It stands for small intestinal bacterial overgrowth. And it really is kind of by definition an imbalance of the bacteria and microorganisms in your gut that maintain a healthy digestion. And so most of our gut microbiome has bacteria in the large intestine. So we've got our mouth, we've got our stomach, we've got our small intestine, we've got our large intestine. And if you've been with me through my digestive webinars, then you understand the process of digestion and how it hasn't. If you haven't seen those, look at those. It's going to give you a good idea of how digestion is supposed to occur normally so that you can find out where there may be an issue. But bacteria in our microbiome are usually limited mostly, let's say 90% to the large intestine. And that's where they can ferment fibers and they can make vitamin B and K and help develop our immune system and help make our neurotransmitters. So when those bacteria that are normally, seen as good bacteria and they have lots of benefits for the biochemical processes in our life, migrate into the small intestine where they're not supposed to be, that's when we start having issues. That disrupts, nutrient absorption, and it can trigger all kinds of symptoms like bloating and irritable bowel, brain fog after eating. And so, these aren't necessarily bad bacteria in our gut. They're an overgrowth of perhaps good bacteria at times, and they're in the wrong place. So it's like they're in the wrong real estate, and we have to make sure we figure out why they're there, we get rid of them, and then we repopulate appropriately. I don't know how this slideshow is working for me. There we go. A healthy versus a bacterial infected intestinal tract. So in a healthy gut, the bacteria are concentrated, like I said, into the large intestine here. And when there's bacterial overgrowth, they get pushed into the small intestine. And the small intestine is where we absorb a lot of our vitamins and minerals, where we do some digesting. There's the gut immune barrier. So Sometimes when those bacteria are there, they're eating our healthy nutrients. So one of the things that is always a question mark in my mind is when a patient comes in and they say, I eat red meat, I don't have a heavy period if they're female, and I'm always low in iron. Uh, and one of the differentials for me would be that they have bacteria in the wrong place, not allowing them to absorb iron. There's lots of other reasons why that would happen, but that would be one of the red flags for me. So it does interfere with nutrient absorption. It can lead to a wide variety of symptoms in the gut. And so we want bacteria, we want healthy bacteria in the gut. We can even tolerate some, commensal, maybe not so beneficial bacteria in the large intestine. But as it starts to move up, it really does interfere with proper digestion, and really a cascade of symptoms can happen after that. How what kind of symptoms do we see in bacterial overgrowth? And let me just say one of the other causes that's really common is chronic constipation. So when you have chronic constipation, if you think about you're eating food, it's going down your digestive tract, it ends up in your sigmoid colon, and you have a bowel movement to get rid of it. If you have chronic constipation, there is a backup of that stool, and there is a backup then of that bacteria, those fibers that they don't ferment properly. And so that's one of the first things I look at when someone's got constipation, chronic constipation, is do they have bacterial overgrowth? Is that one of the many factors causing some of their symptoms? So, in terms of digestive issues, oftentimes when someone has bacterial overgrowth, they'll have gas and bloating, pressure, abdominal discomfort, alternating diarrhea and constipation, nausea, and even bad breath. And if you were with me for previous webinars, especially the ones on H. pylori, you also know that bloating and gas can occur when you don't have enough stomach acid. So the rule of thumb here with bacterial overgrowth is somewhere between 45 minutes, 60 minutes, and an hour and a half after you've eaten. If that's when you experience bloating, not right away, but a little bit after, that's when we think, okay, maybe now those fibers have gotten into our small intestine and they're creating some gases, creating bloating, because the bacteria that shouldn't be there are now there, and they're creating these byproducts. And it's increasingly shown in the literature that people with irritable bowel syndrome, when they go on a low FODMAP diet, which we'll talk about, and they starve out some of this bacteria, their alternation between diarrhea and constipation can change, and they can actually heal their gut. But bad breath is one of those too. So if I have patients who are like, I don't have anything wrong with my dental hygiene, I brush my teeth all the time, I don't eat bad food, and I always have bad breath and a terrible taste in my mouth. And that's usually because the digestive system is off and things are fermenting where they shouldn't be fermenting. Now, systemically, what you could feel, which actually is very common in my practice, is feel fatigue about 45 minutes after eating. And even if you didn't overeat, and nutrient deficiencies that are unexplained, like B12 and iron, weight loss, joint pain, which a lot of people don't get the connection between the food you're eating and joint pain, and vomiting, feeling like vomiting and nausea about 45 minutes to 50 minutes after eating. And the one other thing that isn't mentioned here, but I see so common, is people say, "Well, I can't eat a lot at one sitting. Like I don't feel good eating a big meal, but I have to eat more often because I'm not able to eat a lot." That is one of the hallmarks of small intestinal bacterial overgrowth. And actually eating like frequently doesn't allow your digestive system to actually work through digesting the food, and that can in turn make the bacterial overgrowth even worse. And then when it comes to skin and mood, it's really interesting. Depression and brain fog are very linked to bacterial overgrowth. Same with acne and rosacea. So, the traditional treatments for things like acne and rosacea are topical, but the skin is really a reflection of what's going on in the gut. And so when people get red after they eat, usually it's in their face, and it's not because of alcohol. It's usually because of something they've maybe eaten um, that has maybe now flared some of the microbes in their small intestine that shouldn't be there, and they're producing gases and byproducts that are inflammatory. Okay. Don't know why this isn't changing. There we go. SIBO really does affect the whole body. And this is a great infographic for me. Nausea and diarrhea, malnutrition because you're not absorbing nutrients, even if you're eating a really healthy diet. That's the key here. People will come and say, oh, I'm eating really healthy and I still feel really bloated and I still feel gross. I feel 6 months pregnant at the end of the day and I'm eating well. The fatigue is also very, very common. depression, weight loss, vomiting, bloating, all of these things are incredibly common. Um, and it has a significant impact on the entire body, and it's almost always misdiagnosed. Traditional medicine sees small intestinal bacterial overgrowth generally only occurring after abdominal surgery. And that's really not the case. I see it in teenagers these days. And that's due to a lot of different factors that we're going to go over. So, why does SIBO happen? How does that happen? Let's just try and get to this next page. There we go. Motility issues in the intestines are one of the things. So, neurological connection to the migrating motor complex, which actually like moves the food down the intestinal tube. If you think it's a long set of tubes, and there has to be a pulsation, like a wave-like peristaltic kind of um, pulsation that helps move the food and the bacteria through the small intestine between meals. So when I said eating often is often a complicated factor in SIBO because you feel like eating a lot. At one time, you feel full quick, but then you have to eat often. Why that's a problem? When we start to chew, our small intestine stops moving, kind of that peristaltic migrating motor complex kind of slows down to take in the food so we can absorb the nutrients, and the large intestine moves. And a lot of us, you may know someone who eats and then has to go to the bathroom 20 minutes later. So that's because that large intestine is being stimulated with the chewing. Really important. And then as we stop eating, when we stop eating, that's when it's time for our small intestine. And that's when our small intestine turns on and starts to move the food through those, you know, dozen of feet of intestine. And it needs time to get through there. So eating every 2 hours, every time you start eating, your small intestine stops with this wave-like motion and waits for the food. And if you're never getting the food through your small intestine because you're not taking enough break between meals, then you are creating a backup of bacteria, a backup of food. Things ferment, we get bloating, and there's so many other issues. So motility issues and motility issues can come from hypo or hyperthyroidism, more commonly hypothyroidism. So it's really common for people with hypothyroidism that maybe hasn't been diagnosed yet, that have constipation, that have a slower digestion. They say, "Me, I have a slower digestion." Lyme disease and chronic infections that are, rarely caught in conventional medicine, just because the training isn't there, and we're always looking for the traditional things first. Autonomic nervous dysfunction, even stress, these things can cause um, slowness in motility. Diabetes related gastroparesis. So gastroparesis is basically like dysfunctional migrating motor complex, for basic definition. But the one thing that I notice the most is that, and when I work with people that have bacterial overgrowth, and it takes time to get rid of it, layers and layers of it, they're snacking all the time. They're never really hungry, so they can't have a big meal, but they need to snack all the time because they can't make it more than 2.5 hours without eating. And we're not talking about small children. We're talking about people who can sit down and have an eat, like a teenager can sit down and have a meal. They really shouldn't need any more food for 3.5, 4 hours, unless you're doing, a very busy sport and they've expended a lot of energy. But you really shouldn't have to eat more than every 4 hours. It's actually good to take that break for most people, for the most part. There's some exceptions to that rule, so that you allow your body to actually digest properly. So too much snacking is a huge problem as well, and I see it all the time. Uh, in this newer generation of adults because they don't make time for eating, so they just snack and they're never really full. They're always really hungry, and they never fully digest. Thyroid disorders and GI motility. So the thyroid is linked to hypothyroidism, hyperthyroidism, is also linked to hormonal balances triggering autoantibody production, and this can disturb bile secretion. So bile is something that we store in our gallbladder, and bile is one of those missing factors that we need to help. It not only is released it's made in the liver, stored in the gallbladder, it's released to help sterilize the small intestine, also helps with the contractions. So, one of the things that if you have been treated for bacterial overgrowth and you've kind of taken away the food, did some antimicrobials, and it came back, one of the reasons it comes back often is sometimes due to these thyroid or motility disorders. And sometimes we have this problem with our bile secretion. And that's one of the biggest pieces that we always make sure we check, because it's how we actually eradicate SIBO for good and it doesn't keep coming back because it's just a symptom of a problem. Um, so we can get this disturbed bile secretion, and then we can end up having dysphagia and gastritis. So inflammation in the gut. Dysphagia is like inability to swallow really well just because the GI motility changes. Nausea and vomiting because we're not having, proper digestion, and sometimes even GI bleeding. So this is a really interesting article. I try and look for the research in there to help support what I'm seeing in my clinical practice. Autoimmunity can drive bacterial overgrowth as well. And there is, gastrointestinal dysmotility, so inability to properly move the food through the GI tract. And then key reasons why you might have this is you might have parietal cell antibodies, and this can happen for the autoimmunity is a very interesting full another topic we will discuss at a point. But usually there is something that happens in the gut, some intestinal permeability that will help trigger that autoimmunity, along with maybe a genetic predisposition and some sort of other factor like a bacterial overgrowth, a pathogen, maybe a really triggering food that the body doesn't like. But this parietal cell antibodies, when you have this kind of autoimmunity, lowers your stomach acid production. And low stomach acid, we need our stomach acid to help with gallbladder contractions. And as the gallbladder contracts, when you have enough stomach acid, again, we talked about it in the last page, it starts to help sterilize the small intestine and push everything down and help with that motility. Hashimoto's thyroiditis, one of the most common reasons for having hypothyroidism or slow thyroid, can drive this dysmotility as well. And then other autoimmune conditions like lupus, Sjogren's, and scleroderma can cause nerve damage, and that can also cause dysmotility. So lots of reasons why you could get to this place of having SIBO. Sometimes there's anatomical abnormalities, and we talked about surgery. So some structural problems, and this is a very complex issue here, but you can see how things move through the gut, and you could have a direct blockage, you could have adhesions, strictures, prior stomach surgery that can alter the way the gut is actually structured. And there's some scar tissue, and that can happen if you've had the stomach stapling, or if you've had any kind of, even if you have some sort of ulcerative colitis or Crohn's and you've had some surgery in there, you can get some adhesions in there, and that can create some bacterial overgrowth. Nervous system damage, either direct nerve damage to the nerves or indirect damage to the nerve, can impair the peristaltic wave-like action of the bacteria and the food down the small intestine. And then you can have ileocecal valve dysfunction, which allows the colonic bacteria to backflow into the small intestine. It should move from the small intestine down to the large intestine. And between the small and large intestine, there's the ileocecal valve. And if that is not closed and open properly, then it will allow bacteria to push back up into there, especially in cases of overeating and or constipation, as that poop has nowhere to move. Some medications can injure the gut and create a bacterial overgrowth. So long-term or repeated use of these medications. And, just a disclaimer, you are on your medication because the person who prescribed it, understands it's important to you. But understanding what the side effect of anything that we take and understanding how to mitigate those effects is really, really important. So talking to your healthcare provider who's prescribed you any of these medications is really important to make sure that you don't end up with bacterial overgrowth. So proton pump inhibitors, antacids, they reduce stomach acid, which is normally our first line of defense of bacterial overgrowth. Again, through just sterilizing the stomach, but also with that gallbladder contraction. So PPI, so proton pump inhibitors, can increase your risk of SIBO, and some studies have shown by 71%. So it's really important to understand why you're taking things and then how you can mitigate actions. Some antibiotics, and we need antibiotics, they can destroy some of our beneficial bacteria, which leaves room for the bad bacteria to kind of overgrow and create that bacterial overgrowth. And some opioids and NSAIDs, so anti-inflammatories, can slow motility down and can compromise the integrity of the intestinal lining. So lots of reasons why we could have bacterial overgrowth. This is one of the studies we looked at that showed, it was a meta study that showed on 7,000 people that there was a statistical significant association between increased risk of small intestinal bacterial overgrowth and proton pump inhibitor or antacid use. Again, not to say not to use them, that's out of my scope of practice, but really to understand when you are taking something long-term to looking at the side effects. In this study, they looked at 19 articles, so it's a pretty good meta-analysis. Antibiotics can disrupt the microbial community. You're trying to kill some bacteria. That is the purpose of the a biotic, it's important to get rid of that, but it can throw your microbial balance off. It can cause an overgrowth of Clostridia bacteria, which is really common in bacterial overgrowth, as we see Clostridia bacteria, and it can take a long time to recover. So just understanding that how to mitigate those things. Diet can be a huge driver. And this is what I see a lot of. We talked about the snacking often, but refined carbohydrate diets and high sugar diets, even if you're not eating a lot, but you're drinking, I see a lot of young people drinking a lot of sweet drinks because they're too busy to eat something. They have too much work. And so they eat these, really high carbohydrate laden food, which can feed yeasts and bacteria to make them overgrow. So if you've ever been to your gastroenterologist, excuse me, and you've been complaining about bloating, you may have heard of the idea low FODMAP. And I'm not going to talk a lot about low FODMAP diets, but FODMAPs are basically fermentable carbohydrates. And people who have bacterial overgrowth like this usually don't do well with raw fruit, um, pastas, breads, anything that's high carbohydrate because it's not absorbed very well. And so they tell you, and that will create a lot of bloating. So you might be told, go on a low FODMAP diet. And a low FODMAP diet is great for a period of time, 6 to 8 weeks, because vegetable fibers also feed these bacteria. And that's okay to get rid of the symptoms and kind of have a little bit of die off. You starve the bacteria a bit. There should be maybe an antimicrobial approach to that as well. But at some point, you have to be eating these fermentable fibers because they're good for a bacteria, the ones that are in the right place. So you may have been told to use a low FODMAP diet. It may have been told to use this a specific carbohydrate diet, which also eliminates grains and sugars in most processed food, which might help starve some of the pathogenic bacteria. But remember, sometimes it's healthy food, the salad, the fibers that are very hard to tolerate because that bacteria is just overgrown so much. And then you can do an elimination diet. You can take away the most inflammatory foods, much to most people's dismay as they start with me. Gluten and dairy are the most inflammatory, kind of most irritating foods to the gut lining in general and disruptive to the microbiome. So these are kind of some of the strategies that people can use, even in integrative medicine, to try and see if they can starve out. But a lot of my patients who have come to me have done the low FODMAP diet, specific carbohydrate diet. They've eliminated almost everything. They get to the point where they're like, I can eat 6 foods, and that's all I can eat. And that's also not a great strategy. And then impaired immune function. So we've got a lot of autoimmune system disorders. We've got a lot of people with low secretory IgA, which is our gut immune system. So a healthy immune system will manage its own microbial population through this secretory IgA. They're like the bouncers at the beginning of the bar that if anything looks dangerous, like a dangerous stranger, they're going to get rid of it. It's not very specific to any one thing, like maybe an immunoglobulin that's like an IgE or an IgG that's to a certain food or like a bee sting. But it is our first line of defense. Antimicrobial peptides will have, and our immune systems surveil, our gut all the time. So when our immunity is compromised, we can have a problem and we can get bacterial overgrowth. And some of the risk factors are chronic stress. Chronic stress will suppress our gut immune system, our secretory IgA. And if you've had chronic stress for a period of time, you may have just allowed that immune system function to be depressed enough that you get this bacterial overgrowth. Nutrient deficiencies in zinc and vitamin D and vitamin A can also create impaired immune function. And that means our body can't manage, that balance of microbes. Immunosuppressive medication, and then some people with immunodeficiency conditions can also have this issue. So testing for SIBO in our practice is done one way. I often will get an idea if someone has bacterial overgrowth if I ask the question of my patients who are bloated or who have irritable bowel and constipation. Do you feel worse right away after you eat within 30 minutes? Is it like 45, 60 to an hour and a half? Or is it after 2 hours? So in that middle section, 30, 45 minutes to about an hour and a half, is usually when you have bloating there or symptoms where your stomach starts gurgling, you're like, oh God, I got to go to the bathroom. That's usually when you have small intestinal bacterial overgrowth. And so that's a first kind of question I might ask someone. And then we always do functional medicine testing in our practice. Now, the lactulose glucose breath test measures hydrogen methane gas produced by bacteria in the small intestine. And that has been the gold standard for a long time for SIBO diagnosis, even in the conventional field. But I have found that it misses the bacteria that don't produce hydrogen methane, that produce other gases. And so we've gotten to the place where we use the GI map, a stool test, to see if there's bacterial overgrowth in the large intestine, and we use organic acid testing, which is a urine test that'll detect bacterial metabolites, byproducts of bacteria and yeast and nutritional markers. And that will give us an indication also if there's overgrown bacteria. And very frequently, Clostridia, which is a species of bacteria, will be overgrown in SIBO. It's one, and maybe one of many things that are overgrown. It's not usually one thing, unfortunately. I often find that not only do we find that bacterial overgrowth in our urine test, but we also find some gallbladder dysfunction. We may also find stomach acid issues. So it's usually like a chain of events that have created SIBO as actually a symptom more than just like the root cause. It used to be that the root cause was SIBO, and if you just, take the medication, and they use a lot of good medication for it, it comes back because you haven't fixed the reason why it started. So finding it through this organic acid testing and stool testing, I find to be the most effective. Again, I wanted to mention the lactulose glucose breath test because it is still traditionally used and some integrative doctors use it. I find it misses a lot of things, which is why I do the other things. I don't want to miss things. Patients have usually been suffering for quite a few years before they come with bloating and feeling, uncomfortable, and with, chronic constipation and diarrhea for long enough that I really want to make sure I've tested as much as I can so I really understand how to get to the root cause. So functional medicine, if you haven't heard of it, uses this 5R framework, and it looks at the root cause of restoring the gut health, and it can address it from all the different angles. Let's just see. So you're going to remove, so these are the 5Rs. And in our practice, this is how we generally deal with almost every disorder because we start with the gut. If you have autoimmunity, if you have hormonal issues, they all really have to be rooted in, proper nutrient absorption, proper gut barrier, proper immune system function. A lot of that is starting in the gut. So we're going to remove triggers. We're going to remove food triggers, stress triggers as much as we can. Dietary stressors, like I said, the gluten and the dairy sometimes. Sometimes there's a food that someone knows upsets them. Um, Seed oils are very inflammatory for most people's guts, so we may remove those. We want to look at pathogens as well. We do that GI map and that organic acid test, and we want to look at which pathogens are there that shouldn't be there. Are there pathogens in the small intestine that shouldn't be there? And then take an approach to remove those pathogens. Now, conventional medicine, generally speaking, won't do a stool test, they'll do the breath test, and then they'll go through a series of removing the pathogens by using some antibiotics. Rifaximin is really commonly used. And so they do the step one. But what happens is they don't go through the other steps. And this is why SIBO treatment conventionally almost always fails. People almost always get it back because diet hasn't changed and we haven't done all the other steps. So the second thing we want to do is we want to check, is there enough digestive enzymes? Is there enough hydrochloric acid in the stomach to help with that gallbladder contraction, to help the bile be released, to help sterilize the small intestine? Are there enough bile acids? And you can look at that testing as well. You can get an indication if the gallbladder is working properly. And if the bile acids aren't working properly, you want to replace those and help stimulate that gallbladder function. And there's many ways to do that in our functional medicine practice. Our health coaches really work with our patients hard to get through these steps. And you want to make sure you have enough digestive enzymes. Then you want to re-inoculate and replace beneficial bacteria. So it's like you're pulling the weeds out, but then you have to seed in the good bacteria. Even if you're weeding out some of the good bacteria in the small intestine, as you replace the reasons why those digestive secretions, you increase the gut motility through vagal nerve stimulation, stress reduction techniques, you will be able to re-inoculate the beneficial bacteria that you may have killed some of when you were working on removing the pathogens. You want to repair, heal, and restore the gut lining. And you can use that. You can use bone broth. You can use glutamine. You can use zinc carnosine. There are many different things you can use there. And we use a combination of food and supplements because I think it's important to do. And then you want to rebalance. So you're going to optimize the lifestyle. Actually, we do that through the whole process. We start working on stressors. We start working on digestive function, vagus nerve function. We'll start working on not snacking all the time. This is a big one. So if you're bloated all the time, I have two tips for you that may change your life in 2 days. Chew your food, sit down and relax and chew your food. Your body then understands which enzymes it needs to release to help digest the food so you don't have like a bunch of food that hasn't been digested that can't make it through the small intestine. And as you chew, your large intestine will move everything out and your small intestine will wait and will be ready to absorb those nutrients. And the other piece is don't snack so much. Oh, I'm so sorry. Don't snack so much. Try and make it 3.5 to 4 hours without eating. So if your meal wasn't big enough for you, if you slow down and you chew and you've got some fat and protein in whatever meal you're eating, you should be able to go 3.5, 4 hours without eating. This is for the general population. This isn't for a malnutritioned, anorexic person. This isn't for someone going through chemotherapy, a burn victim. There's very special cases. This is generally, most people should be able to go about 4 hours without having to eat again. So try to sustain or abstain from snacking. And if you need to, and if you feel like you're hungry an hour and a half or 2 hours after you've eaten, with the next meal, make sure you've got some fats and some proteins in there so that your blood sugar stays a little stable and it doesn't drop and you don't feel the need to snack. Those are the two things: chewing, sitting, relaxing, and try not to snack. And see if in 2 or 3 days that really changes your bloating, your constipation and diarrhea. It can make a big difference. Um, so the 5 R's in this framework for functional medicine, for really healing the gut, is remove, replace, reinoculate, repair, and rebalance. And that's why when we take people through our functional medicine program, we really go through these, we go through 6 to 8 months of working on things. There's a step, there is an order depending on what is wrong with someone. There's an order in which you want to do these steps so that you get the maximum healing, but also you shift your body's digestion, your immune system response, so that you don't get this again. It doesn't come back because you've actually fixed the reason why you got this bacterial overgrowth. And that's really what I want to leave you with. The bloating, the constipation and diarrhea is a message from your body saying, like, I'm unhappy. You ate something, you ate too fast, you were stressed when you were eating, you haven't been pooping. All of those things are messages, and you have to go upstream to look at why it occurred in the first place. And there's multiple factors. It's never like one thing. Hey, we found the one thing, let's fix that one thing and now you're better. That's not how the body works. It can take a lot of dysfunction before it starts to break down. And using this 5R framework, which uh, the functional medicine approach really uses, is the best bet for long-term eradication of SIBO and better digestion and health overall. So let's just go over that real quickly. When you're removing, you are eliminating, especially with SIBO, you're eliminating these high FODMAP foods. And you can look up a FODMAP diet. You're going to starve some of these pathogenic bacteria, but more, you're going to like just not have the bloating of the symptoms. You're going to use these targeted herbal antimicrobials like berberine, oil of oregano, alicillin. I don't use oil of oregano often, and I will use it sparingly, but berberine and alicillin, which is from garlic, I can use. The pharmaceuticals they use is rifaximin. You're going to eliminate frequent snacking so the migrating motor complex can work. And you're going to address the underlying infections, the parasite, the yeast, the fungus that are contributing to the dysbiosis, which is the imbalance. You're going to replace digestive enzymes. You're going to help the body make more hydrochloric acid. You may replace some of it, but you might also teach the vagus nerve to work better. You might support bile acid production, which will also help with antimicrobial activity in the small intestine, and you might support the pancreas. And you can find all these things on these functional medicine tests and really understand where the dysfunction is happening. You reinoculate with targeted probiotics. We usually use a combination of lactobacillus and bifidobacter and some soil-based organisms. You might add some prebiotic fiber, which would feel terrible early on in the treatment protocol because it would bloat you even more. So having fibers before you've gotten rid of the pathogenic bacteria and the overgrowth and the dysbiosis, the imbalance, would be a really bad thing to do. And you're then going to start including fermented food, which are full of different bacteria, which are really important. So if your small intestinal bacterial overgrowth hasn't quite gone away, you'll know because you'll try and eat some of these fermentable foods and you will feel bloating again. So, being really patient for a couple of months while you're going through the layers of bad bacteria, yeast, pathogens is really important. You're going to restore the integrity of the gut lining, which is one of the most important parts, especially when you've got the autoimmune kind of response and the migrating motor complex dysfunction because of that. So you're going to add some zinc. You can add some omega-3s. You can add some L-glutamine. One of the reasons I really like using bone broth is that you get the zinc and the L-glutamine in the bone broth. So I like to use that as part of the food type of repair, especially when I'm working with young people, having a cup of bone broth or making soup in bone broth or making your food with some extra broth, your veggies can really help have these key nutrients in there to help repair your gut lining. And then you're going to rebalance. Lifestyle is truly the foundation of lasting gut health and overall health. Lack of sleep, problems with stress management. You need to move. Everybody needs to exercise. If you just started doing these three things, you would feel better with all of any kind of symptom you had. Because SIBO has a very high recurrence rate if we don't take care of the reasons why it came. So gut repair and microbial regulation happen during sleep. So we're looking for 7 to 9 hours of sleep. Some of us need more than others. Chronic stress will impair the motility and the immune system function, like we talked about. And regular exercise not only stimulates the movement of the migrating motor complex, but what's interesting is research studies show that when we exercise, we change the microbial diversity in our intestines to be more with the beneficial bacteria, and it helps with digestive motility. So that was a lot. I'm going to look for questions, but I just want to tell you that our offer at the end of this webinar is really booking a metabolic assessment. So if you've been suffering with the bloating, the constipation, the brain fog after you eat, and you have no idea where to go, you've seen lots of doctors, you know, before doing that deep testing, a metabolic assessment is a really great way to dip your toe into looking at which systems and organs may be dysfunctional. Where can I take a look we have a very in-depth history that we take, and we can gain some really good insights based on systems of your body, where the dysfunction may be, and give you some good suggestions. We'll be offering it for $199, and we're really looking at how to get more energy, beat your cravings because you're digesting better, less bloating and constipation, and for sure that diarrhea and constipation back and forth, and improve focus, brain function is better, and overall reduction in inflammation. So that is our offer here. If anyone is interested in taking it a next step further, you've tried things, you don't know how to do it on your own, booking a metabolic assessment, I'll be going through it with you and give us elucidate a little bit about where in your body there may be dysfunction happening and what first steps you can take to slowly start helping your body heal from your gut dysfunction. If you want to know how to book your metabolic assessment, you can go askdrchristina.com. On that website, you can click my assessment, and then there'll be an intake form, and someone will reach out to you for the next step for booking. These are ways that you can get me online. If you haven't already, I'm at Ask Dr. Christina on Instagram and YouTube. Our website is bostonherhealth.com. And this is where I love to give information, and you can reach out to me. I do one-on-one functional medicine programs, but if you're just starting, going on Instagram and YouTube, looking through some of the older webinars on digestion will be really important for you to figure out where in your diet and lifestyle, where in your life you can do a little bit better, take a little bit better step to help yourself with what you might have as bacterial overgrowth or in general overall health. It's so my pleasure to hopefully give information that is useful and easy to integrate into your lives.